Hi everyone, it's Sanya from Farmer Questions here. In this video, we'll be taking a look at the skin condition impetigo. So, what is impetigo? Impetigo is a contagious superficial bacterial skin infection. Contagious meaning it can spread from one person to another, and superficial meaning it typically affects the top layer of the skin, the epidermis. While impetigo can affect all age groups, it is most commonly seen in young children. There are two main forms of impetigo: bullous impetigo and non-bullous impetigo. Bullous impetigo is caused by the Staphylococcus aureus bacteria, and it typically presents as fluid-filled vesicles and blisters which last 1 to 3 days. When these vesicles burst, they leave a thin, flat, yellow-colored crust. Common areas bullous impetigo affects is the face, the trunk, flexures, and the limbs. Treatment for bullous impetigo is oral antibiotics. This is because applying topical treatment on the fluid-filled vesicles can be quite impractical. First-line treatment is typically flucloxacillin, and if this is contraindicated or not tolerated, the alternatives include clarithromycin and erythromycin. Now, let's take a look at non-bullous impetigo. Non-bullous impetigo is typically caused by the Staphylococcus aureus or the Streptococcus pyogenes bacteria, or a combination of both. Non-bullous impetigo accounts for about 70% of cases of impetigo. Non-bullous impetigo typically presents with thin-walled vesicles or pustules which release fluid that leaves a brown honey-colored crust. Commonly affected areas are around the mouth and the nose. Non-bullous impetigo can be subdivided into localized and widespread impetigo. First-line treatment for localized non-bullous impetigo is typically 1% hydrogen peroxide cream, and if this is contraindicated, then 2% fusidic acid or 2% muriposin cream is used. First-line treatment for widespread non-bullous impetigo is typically a topical antibiotic or oral antibiotic depending on how widespread the lesions are. Now, let's take a look at some self-care advice. It's important to remind parents, carers and patients to wash affected areas with soap and water, avoid scratching affected areas, to wash hands regularly, in particular after touching a patch of impetigo, to avoid sharing towels, face cloths and other personal care products, thoroughly cleaning potentially contaminated items or toys. Public Health England also recommends that children and adults should stay away from school, childcare facilities or work until lesions are healed, dry and crusted over, or it has been over 48 hours since antibiotics were initiated. And that's all for this video. Thank you for watching.